Hello, I am Madhukar Trivedi. I'm at UT Southwestern, and we are going to talk a little about benefits of self-monitoring for your mental health. As you know, the real issue that we want to try to address is within the setting of the population that you are really working with. We wanted to emphasize that the issue of self-monitoring, but let me start with a little bit of background. Obviously, in the setting of any medical condition, including HIV, you are not protected from depression. So depression, anxiety can occur with or without HIV. And so one of the issues we need to be thinking about, unfortunately, in the medical field, there's a dichotomy for mental health and physical health. And we all know that people actually don't come isolated for one or the other. So HIV and depression, anxiety actually go together in many instances. So therefore, we need to be thinking about that. So let me give you a little background on that. And then I will go across talking about how best to think about self-monitoring for mental health, mental wellness. That is unique to all, it is not necessarily unique to only those with HIV, but it is something that we need to be mindful of. So depression among patients with HIV/AIDS is actually seen as a major comorbidity. People are aware of this. There's a fairly large body of focus on how best to understand and address it, and I'll address that in a minute. But having HIV itself can be a source of major stress. There can also be challenges with the sense of well-being and complicated existing mental health conditions. HIV and some opportunistic infections directly can affect the brain and the nervous system and can lead to changes in behavior. Example is the inflammation and the immune system is affected with people who have HIV, and that has also been associated with components of depression. So it is not surprising that both needs to be addressed when somebody has HIV. And then HIV obviously continues to have stigma and discrimination. The emotional well-being and emotional mental health of people is affected normally anyways, and then in the setting of HIV and stigma, that just complicates and augments it. The other issue is that people with HIV also end up with antiretroviral treatments, and that can directly have effects. So sometimes these antiretrovirals can relieve anxiety just from the fact that knowing that now the treatment is on board. However, some of the antiretrovirals can cause symptoms of depression, anxiety, sleep disturbance, can make mental health issues worse. So therefore, if there are antiretrovirals on board, you should make sure you talk to the healthcare providers to remain vigilant about symptoms of depression, anxiety, and mental wellness. And some of the medications for mood disorders can actually interact with the antiretrovirals. So therefore, dosing and viral load, et cetera, need to be monitored very closely. There is clearly the need is identified, as I mentioned earlier, and therefore there are many different models people have used, and that is both good and something I want to raise a challenge of. We do not, for example, call integrated care for people who have diabetes and high blood pressure together. We call it medical care. I am hoping that with our work on self-monitoring, et cetera, where we empower people, we will create an environment in the healthcare world where integrated healthcare is really the norm, because without that, without focusing on integrating mental health, mental well-being in the setting of physical health, without doing that, we are actually leaving a lot of our patients undercovered for mental health issues. So there are models, there is integrated care using care managers, and that has been shown to be very effective in improving outcomes for mental health. The trouble that generally healthcare systems have run into is that staffing and reimbursement for those issues has been a problem. So therefore, finding a care manager, a social worker, to be within the setting of either an HIV clinic or just general medical clinic has remained a challenge for healthcare systems. And so when integrated care can be employed, that is the best solution. But the other options are to create a single facility that has all of it together. And there are places that are doing that very well, and that may be the second option. The third option is creating a multi-facility integration. This, while helpful, necessary in cases where the first two are not possible, remains a challenge, because then you have to have the patient go to two places, monitor the scheduling and all that. But what we are again trying to do with the self-monitoring approach is to make you all empowered so that you can demand. Some of it is just making sure that the medical provider takes care of the mental health needs. In general, it is, in my view, humble opinion, a tragedy that we have to depend on patients to really ask for it. Otherwise, ideally, the medical system should be taking care of it. Nevertheless, I think the bottom line is the best approach would be to have the mental health sector and the HIV sector together, working together through a mental health, primary health care sector approach. So all our work in depression through the center has been to try to empower primary care providers to be the fulcrum around which medical and mental health care happens. And we have a number of systems in place. One of them is basically measurement-based care approach through a software we have developed called Vital Sign 6. That has produced significant benefits for outcomes. Remission rates have jumped quite extensively in our network of primary healthcare providers. However, we wanted to actually go beyond that advantage and go directly to everybody, get them informed, engaged, and therefore empowered to do the kinds of things that we have as a society begun to do for other things, like daily exercise. There is, as a society, a big emphasis on that. There are many. I use a Fitbit, for example. Others use different approaches to monitor the level of physical activity they get. The CDC, all national organizations recommend doses of exercise that individuals should engage in, monitor, and all that. And that has significantly improved the health of people in the United States. Similarly, there is a focus on diet, and there is a lot of information coming out. There's a lot of cognitive behavior therapy approaches to monitor the kind of food people eat and type of an amount of food, and therefore focus on healthy diet. And finally, on weight. And all these three things have taken time. 30 years back, that was not routine. It has been now much more in vogue. And now I don't think that populations in general are unaware of the ways in which you can self-monitor, empower yourself, and keep track of exercise, diet, and weight. That really has benefits for cardiovascular health, for metabolic health like diabetes, and even mental health. But in addition, like we do with blood pressure, like we do with blood glucose, like you do for HIV with viral load, we need to be thinking about a much more comprehensive approach so that you're taking care of not only the body, but mind and emotions in order to really aim for getting full overall health that is both physical and mental health, so that there is a whole health approach. And we are really convinced that bringing mental health wellness and mental health monitoring requires a two-pronged attack. Obviously, working with primary care medical systems in order to incorporate the goal of bringing physical health, mental health into the physical health realm is one goal which we have done and we are continuing to do. But the second part is to empower human beings to think of their health as a complete physical and mental health. And that means the one way to do that is to self-monitor. It's very simple. In fact, 30 years back, we used to have maps and you would think about how to drive from point A to point B. Now, very few people worry about it because there is a map. If you know where you're going through GPS, I think of this as creating a GPS so that you know where your wellness is, monitor it, and keep track and intervene where necessary. And what we have developed is a self-rating tool, self-monitoring tool that allows for real-time collections. Even more than medical conditions like diabetes and high blood pressure, for mental health, it is important to have an approach that allows for all of us to record in real time. Very similar to diet. I think if you were to ask somebody, how has your diet been for the last 6 months? It's very hard for a person to actually give you a good enough, reliable report. Therefore, there are things like daily diaries and other apps that allow you to monitor what you're eating, how much you're eating. Same for exercise. For mental health conditions, the same thing, and therefore that is allowed by this app to do real-time collections. And then you get tailored feedback to support and reinforce positive changes. You have bad sleep for 2 days, the app will provide guidance on how, at least to be attentive to it and maybe take some steps to improve your sleep habits. Something additionally this software allows you to do is reveals insights into the dynamics of psychological processes, such as they naturally develop. So predicting relapses or to track treatment response. Both of those are essential for people to do in real time and on an ongoing basis, because otherwise what we traditionally see in clinical care is somebody started on an antidepressant treatment, they do feel better, 2 months later they actually start feeling they are better, and then their symptoms may come back, but no way to monitor, so that 9 months later they go back to the doctor and say, for the last 6 months I've been depressed. That is really wasting somebody's time, the patient's time. And therefore, what we want to do is to do it in real time. So this monitoring device will allow you to first track whether you're getting better or not. And then more importantly, will give you indicators that the symptoms or function or wellness is going down, and therefore contact your primary care provider. And as I mentioned earlier, it does avoid recall bias in retrospective reports. So what has research shown about self-monitoring? There are very good data showing self-monitoring tools are associated with improvements in clinical outcomes. I don't think that it requires a rocket scientist to believe that. I mean, this is simple, straightforward. If you monitor and if there are things that are not going well, get the necessary help, then it is clear that outcomes will get better. Even a study of young adults in early stages of depression, this is early, showed that self-monitoring increased emotional self-awareness. And that is the first step to really getting continued wellness. People with recurrent depression, which is a very large population, self-monitoring helps to prolong periods between depressive episodes. And in fact, triggers getting back to help from the providers very rapidly, so that you're not delaying changes in treatment that may be necessary. And then finally, self-monitoring also has a motivating effect. If I know how the trajectory is going, then either I can feel satisfied that it's going well, or if it's not, then I can actually seek help. That is sort of the goal. But in general, the self-monitoring has many advantages, and the left part, the empower yourself to be more aware, is our ultimate goal. I think my sense about this is that the more somebody is informed and the more they're empowered to demand what is essential for their mental wellness, the better we will be. It also helps you notice trends, engage in resilience prevention, so that you make early changes rather than wait until somebody has had 6 months of dysfunction. It does capture important data for healthcare providers. So if you take this tracking tool report back to the doctor and say, I've been doing this for the last 4 weeks, and this is what's happened, they can actually make the necessary treatment changes. The tracking itself is a springboard for more information, collaborative conversations with healthcare providers. They can guide you to get some additional psychotherapy, some additional exercise. It can learn and raise awareness. It improves self-management and then establishing a healthy attitude and behavior. So this is why monitoring, self-monitoring is really, I don't think I have to convince people that self-monitoring is good. What I end up having to convince people is, A, it can be done. Second, we have tools that are very reliable. And third, we have a system, which is what we are developing. And that is the question that I always get asked: is there a way to measure and monitor our mental and emotional wellness? And that is what our tool is, called Evixia. It's a Greek word for individual, for wellness. And this software is a web-based application. It is individual focused. It's cloud-based screening tool that allows you to monitor your mental health. Once you start using it, you can track your wellness and depression, anxiety over time. You do receive information and recommendations to improve your well-being. You can see in the graph below all the symptoms, function, quality of life, interpersonal functioning, work and productivity, overall satisfaction, etc., is tracked. There are many options to monitor. There are more tools available if somebody wants to be more expansive. And that then gets graphed with recommendations, as you can see on the right side, for things that are, so for example, when somebody's symptoms here are getting worse, they will get in recommendations for the types of symptoms that are really accounting for this worsening. So it equips to partner with your healthcare provider in a meaningful way. And as I keep on saying, it empowers individuals who may have symptoms of depression, anxiety to take charge of their journey to wellness by monitoring and managing mood and functioning. This is really the sort of flyer we have about how do you do this in terms of services from home. You can complete regularly using dashboards, as I showed you. That really is what has captured the imagination for a lot of people, because once you see that dashboard, it actually is another empowering tool, because it guides you to say one way or the other whether you need to do more or you're doing fine. You do receive tips for improving symptoms and bring these reports to the doctor. It provides self-report measures. So there is all of this and dashboards and recommendations. So this is someone who has been monitoring over time and showing improvement. So you can see that this dial here tells you whether you're on the red, orange, yellow, green, or blue side, so that it gives you a sense of where somebody is. This person's depression is evaluated as moderate, and then based on the ratings or the responses to the questions about decreased self-esteem, energy, concentration, etc., it can actually give you recommendations. So how often should people use it is often the question, and I think that in effect it is available 24/7. Most often we recommend people do it at least once every other week. Sometimes if the symptoms or functioning is changing more rapidly, you may want to do it once a week. If whatever schedule you decide, the software will identify that, and based on that will provide notifications. So if you have chosen every other week and you miss some time, then the software will provide an email or text that says, you haven't done your assessment as you wanted, so go back and sign on, and it allows you as a reminder. And then what we feel is consistent use will allow you to track progress over time, visually notice the trends, and it gives you actually a much better language to use for yourself and to communicate with either your loved ones or your healthcare provider. You can sign up by going to the website, centerfordepression.org, or using this QR code. Some people have any questions, they can email to cdrc@utsouthwestern.edu, and one of us will respond. And I think that this is a way to actually kind of not only depend on the health system to take care of your health, but that allows you to be in the driver's seat, self-empower yourself, And that is probably the best way to ensure not only people will get better, but they will stay well and be able to monitor any kind of rough patches that could occur. Thank you very much, and hope you have a chance to use it, but otherwise feel free to send us a question on our email or go to our website, centerfordepression.org. Thank you.